Hello, welcome to my YouTube channel. I'm Dr. Erickson. I am a specialist in gynecology as well as obstetrics. Today, we'll be discussing the effects of alcohol and substance abuse during pregnancy. Alcohol abuse, use of habitual drugs such as cocaine, heroin, Indian hemp have been shown not to be good to an adult. How much more a tender baby that's still forming inside the womb? Well, first by talking a laboratory. What does alcohol does to a baby that is forming inside the womb? Alcohol can have several effects on the baby. An effect alcohol can have on a baby starts with physical changes that is not normal from the head to the toe to effects on the brain. And this total effects is described under what we call fetal alcohol syndrome. How does baby with fetal alcohol syndrome look? One, the head is small. That's what we call microcephaly, small head. They have this facie that you won't want your baby to have. The eye is small. They have a characteristic nose. And still on the head, the brain is not well formed. So it means that you may have a baby that will have a low IQ. And I don't think any pregnant woman wants to deliver a baby that will not be able to do well in school. When the mate is passing their higher level study in school, they are still able trying to understand between really monosyllabic words. So apart from affecting the brain development, issue with behavioral development, social skill acquisition. Social skill acquisition. Now, it means that the baby may be find difficult learning simple skill, concentration in school. So the effect of alcohol is so enormous on the baby that a pregnant woman should not be encouraged to be engaged in heavy alcohol drinking. And alcohol effect is even worse when it is taken during early pregnancy. And most women that are pregnant, they don't know they are pregnant within the first few weeks of them taking it. And within that time is when early formation of baby is going on. So in general, it's important that a woman that is within age of giving birth and a woman desiring to give birth should desist from being involved in heavy alcohol intake. In general, it's difficult to quantify heavy alcohol intake, but issue of alcohol intake is sometimes habitual. So, alcohol intake in a woman with the age of giving birth should not become a habitual stuff. Now, other substance abuse that may share some effects similar to what alcohol can do is use of heroin. But apart from causing some physical defect on the baby, interfering with neuronal and brain development means the brain is what controls how one reasons, how one develop ability to learn things. They can also cause early pregnancy loss. They can also cause a pregnant woman to develop some conditions during pregnancy. Cocaine intake, heroin intake have been known to cause what we call ambrosial placenta. Means that the placenta will start separating before the baby is delivered. And the effect of this is that the pregnancy is going to be lost. The bleeding associated with this condition can be so much that if care is not taken, can lead to death of the woman. So if you look at all these habitual drug and alcohol intake, the effect of the pregnancy, one will ask question, does each recreational feeling of taking that drug, does it far away the effect of what happened on the baby? When you look at it, you see that it is no way to be on some drug while pregnant. Now, the major problem about this drug is that those that take it are highly dependent on it. So this aspect is where obstetrics cut across with mental health physician. Mental health physicians are people that are trained in managing this condition together with the obstetricians. So if you're experiencing this condition whereby you find yourself, you know You have heard about the adverse effects of taking alcohol, as well as use of some substances that are not good during pregnancy. Drugs that are not licensed or prescribed by doctors, but taken for self-feeling of euphoria, nice feeling, and the rest, as may be taken by those that take such drugs. It is important that you seek for appropriate help. So if you have any question or you have difficulties quitting such drug, there are measures you put in place to help some women with such condition. So you can go to the comment section, you can ask your question on how we can help you. And please subscribe, like and share this video.